Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with Me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about the Dynamic Gait Index. With any functional outcome measure, my recommendation on how to really have it ingrained in your brain is to first understand how to perform it. So let's talk about it. So you can see that there are 8 different tasks to have your patient perform. For all these tasks, your patient will be upright and they are going to walk. Well, aside from the last one, which is having them go up and down some stairs. Essentially, you'll have your patients walk back and forth and perform instructions that you give them. Each one of these tasks are graded a little bit different compared to one another. So depending on what the task is, you are going to pay attention to maybe how smooth the transition is during the task, or whether or not they swayed laterally or stepped outside of the allotted space, left or right, that the person is given, or maybe how safe they did the activity. So I'm going to say realistically, just spend some time reading through the options to get yourself more familiar with what each task is really trying to have you look at. But for the purpose of this video, we're really going to try to understand what the DGI is all about. The first task is to have your patient walk in a straight line. The next one is telling your patient to initially walk their normal speed, then on cue have them walk faster, and then on cue have them walk slower, and then back to normal. Third one is to have them walk in a normal speed, and then when you say left, they turn their head to the left, and then when you say right, they turn their head to the right while they continue to walk forward at their normal preferred speed, keeping their head turned that way. Next one is the same idea, but instead of left and right, you'll have them look up and look down. With gait and pivot turn, you're going to have them walk straight, and then when you say turn and stop, that's exactly what they'll do. They'll just turn around and stop in their position as fast as they feel comfortable, but obviously as safely as they can. Stepping over an obstacle, you place an obstacle along their walkway and have them step over, and you assess how they do so. And then the second to last one is having them step around that obstacle that you placed on the floor, and you're seeing how well they are able to do that. Lastly, you see how they go up and down some stairs, whether they're using the handrails or whether they're able to do reciprocal pattern versus a step 2 pattern. This is a section that you just straight up, unfortunately, just have to memorize. So the test is out of 24 points, and what you'll see is that the interpretations of the results are, or at least can be, very specific. So for example, on this screen, you will see that if a person scores anything less than 19 out of 24 points, that is going to be predictive of a fall, specifically though in the older population. Now, does that mean if an 18-year-old that I see who has had a traumatic brain injury, if I have them do this test and they scored a 17 or an 18 out of 24, so pretty much anything below that 19, that they're not a predictive fall risk? Some food for thought. Now also, it says that anything above a 20 out of 24 suggests that the person is a safe ambulator. Well, what about the missing numbers? 20, 21 out of 24? So of course research is always being done, but just have these numbers in the back of your head when you're considering the DGI. The next thing you should do when you're learning about a functional outcome measure is to really understand what the purpose is and ultimately link it to what you want your patient to do and see deficits in, because all functional outcome measures, their use is to prove something, and likely it's maybe a fall risk. So obviously you can just memorize that the purpose of the DGI is to assess fall risk and assess balance. Sure, you can memorize it. But you also have to understand that there are a lot of different types of ways you can assess balance. So just saying assess balance, what does that actually mean? You can assess static balance. You can assess dynamic balance. You can assess balance in sitting, standing, while walking. And in this case, you are walking. So when you really break any functional outcome measure down, you have to think about the movements that you're going to have your patient do. So it should make sense that you are testing balance with this particular functional outcome measure, given the fact that you're having them move constantly, the fact that you're having them change the way they're moving, whether it's moving faster or moving slower, or stepping over an object, or turning their head sideways so they can't look at the floor to help with their stability. So go through all those tasks and see what it actually tests and challenges for your patient. So once again, aside from just, being one of those tests to assess balance, you really need to consider everything that is tested and why you're doing this test for your patient. Who is this test designed for? Well, first of all, it better be someone that can walk. If you have a person who can't walk more than 5 feet, For example, that just doesn't make any sense to implement this test because you have to have your patient tolerate walking for a little bit or have enough endurance to do that. Now, anytime that you read into a functional outcome measure, you're going to learn all these facts about who it's used for and what it's for and all this stuff. And you're going to see that there are specific populations listed of who it might benefit to test. For example, with this functional outcome measure in particular, it's suggested to have tests with vestibular disorders or with people who have had strokes or multiple sclerosis, etc. Now, with that being said, would you say that that's the end-all be-all of what people can use this test? What if I have a patient who has Parkinson's disease and functionally they're perfect for this test? Perfect for the purpose of showing that they have balance deficits. They're able to walk. They just kind of fit the criteria. Just because a person has Parkinson's disease doesn't mean that they're either too good or too low level for this test. So really, understand that even if a diagnosis, for example, such as Parkinson's disease, is not listed under a functional outcome measure, just use your critical thinking skills to help you justify, oh yeah, this person really would be perfect for this test, despite the diagnosis. Furthermore, I can have an 18-year-old person doing this test. I can have a 90-year-old person doing this test if they're appropriate to attempt the tasks. We're a profession that is largely based on seeing the person as they are and their functional mobility despite what diagnosis they have. So always just critically think regardless of what a piece of paper and even research, even though we obviously prize research a lot, critical thinking skills and see what you can do to best help your patient. If you enjoy material being taught this way, check out our courses at sptwithme.com when you're studying for the NPTE.